Assalamu alaikum, Habiba. How are you?
I'm good. You tell ma'am, how are you?
I'm also good. Can you please introduce yourself so that I give my introduction? Because basically, over here, you're the interviewer and I'm the interviewee. So,
Yeah.
other way around.
Okay. Okay. Um, Basically, I want you an interview about you in this field, psychologist, as a psychologist. So, can you introduce yourself as a psychologist about your field?
Okay. Thank you so much for having me. My name is Dr. Ina Khan, I'm a clinical psychologist, psychotherapist, speech therapist, and I'm working in field since 2011. And
Yeah.
since 2011, me that is actually clinical practice. I'm practicing. It's not like you just went to some other fields and do some other experiments stuff like that. So I am working since
Yes, ma'am.
2011 and I'm working with children and adults. And with children there are a lot of problems, for example mental retardation, learning
Yes, ma'am.
disabilities, autism, neurodivergent disorders. And with adult
Mhm.
with other children, like you have behavioral issues as well, and learning disabilities as well. And with that it is individual counseling, family counseling, couple counseling. So I'm working and I work on these areas.
Okay. Hmm. Okay, ma'am. Um, Let me ask you some questions about your field, ma'am. Can I?
Yes, you can.
Okay. First of all, you tell me tell me that what factors you use with your clients. So, like as you said, you are therapist. What kind of a factor or you use for your client?
uh, I did not get your question. Can you clarify your question?
Okay. What factors do you believe contribute to the
Mm-hmm.
therapist use for their clients?
Okay, you mean for the alliance? I mean, how you are going to basically
Yes,
your
ma'am.
question is
Alliance.
about. Let me
Alliance.
clarify,
Alliance.
clarify you that, or you could say elaborate that this interview is basically therapeutic relationship with your client. This is what I'm
Okay.
getting.
Yes, ma'am.
Okay.
Yes,
So,
ma'am.
okay, the thing
Yes,
is that
ma'am.
whenever a client come to you, then the first thing which is important is to build a trust and to give the
Yes, ma'am.
confidence to the client that because in start whenever you start the therapy, then make sure that you're empathetic with your
Mm-hmm.
client, and you need to clarify a lot of things in front of the client from the start of therapy, that
Mm-hmm.
that confidentiality will be maintained, that trust level should be maintained, and you need to make sure to your client, to talk to your client that uh, we need to trust each other in the sense that the information you should give me should be truthful. If you're not going
Mm-hmm.
with the true
Okay.
no exact information, the exact thing you're feeling, then it is going to create hindrance in your
Mm-hmm.
therapy. So that is the thing. And second thing
Yeah.
is that you need to be true to yourself in the sense that uh, uh, whatever you are feeling is relevant and you're actually feeling these things. So it take a lot of time to
Mm-hmm.
build that form of trust, or because when our client come to you, they're so afraid to talk. Actually, the thing is that
Yes,
they're
ma'am.
afraid to talk, they're
How
afraid to tell you the
so
information that what they are feeling. And because it is a lot process, and maybe you're new in the field, but you will come to get this idea that whenever
yes,
a
ma'am.
person is coming to you, then he went to other places as well. Other places means
Yes, ma'am.
doctors, maybe some
Mm-hmm.
paraprofessionals, and some other aspect they might also have tried, and they come to you at the end when the problem is much worse. So there's
Mm-hmm.
a lot of things contributing in that, but you need to set the goal for the therapy. You need to tell to the client that what he can expect from the therapy, and you should be truthful. As for example, if I said that you're going to talk ask your client that he should be truthful to give you the information, then you should be truthful as
Mm-hmm.
well, that what is the reality, what you can do as a therapist. So you
Hmm.
need and what is your
Okay.
limitation, and what are your set goals for the therapy. So it ways goes
Okay.
both. So maybe it's a mutual process and mutual understanding and mutual trust. So it goes both around. Matlab, the ways should be both way, the
Okay.
trust and the
Ma'am,
confidentiality factors.
ma'am, what you think? How long does it take time or allow to make alliance with your client?
Okay, it always depends on a person, because whenever we talk about therapy, we talk about humans, and humans are divergent. I mean, they are coming from different backgrounds.
Yeah.
And the nature of the problem
Yeah.
is different as well. When you if you talk about the child, then the alliance is different, the relationship
Mm-hmm.
is different. And when you talk about the therapist with adult client, then the nature of the relationship is different in the sense, it means
Mm-hmm.
Because with child you could be playful, but when it come to adult, then
Yes.
you should be very serious in different aspects, and you should be, uh, uh, uh,
Yeah.
and when the child start, because you cannot predict until you see the child or the client itself, if it's an adult, start giving you information which is uh, you know uh, uh,
Yes,
hurtful
ma'am.
for him, that person, and the information which you might not share to the other
It
person.
is easy. Yeah. Yes, ma'am. Yes, ma'am. Mm. Okay. And what factors do you believe that contribute to successful therapy? Make a successful
Okay,
therapy.
okay, the thing is that whenever the
Hello.
the true information come to you, in the sense that what a client is actually feeling, because sometimes, let me give you some example. A father came to for his
Mm-hmm.
child.
Yeah.
Okay, because
Yes, ma'am.
I'm working with both, so I will give you example of child away, so you will get the idea. So the child was on medication, we don't have that idea
Okay.
that the child is on medication, and parent did not disclose this information to us. Okay, what happened,
Mm-hmm.
that the child was somehow
Yes, ma'am.
stable because of therapy, but somehow the child have to
Mm-hmm.
leave to the other place, and he was not coming to us for some reason. So over there the child create a lot of mess, the child break a lot of things, and parent was so was not able to understand what we are going to do with this child, because he's so aggressive, and he's breaking things over there, and he shows aggressive, he's
Mm-hmm.
showing that I want to go to my therapist, I want to go to her, and I want to go to talk to her, because the child was coming to
Mm-hmm.
us, and that was the
Mm-hmm.
the strength of the relationship, that he want to come to us. So that was a thing, that after that the
Mm-hmm.
parent go to some some psychiatrist, and they start giving that child a medication. So when the child came to us, the child was
Mm-hmm.
so sleepy, and his eyes was so swelled and turned red. So I talked to my administration. I said that something is very going wrong. I don't know what is going with that child. And the child
Mm-hmm.
start showing some strange behavior. So we came to know that idea, that was, if the child was coming to us and he was stable, and he was not showing the signs of some aggression and some other things, it was because he was on medication. If the child came to us and we might know that the
Mm-hmm.
child had these issues, we might have work on those things as well, along with his remedial therapies, speech and communication. So
Yes, ma'am.
just because of that thing,
Mm-hmm.
maybe for 3 to 4 months they hide this thing from us, and this came
Okay.
by chance. So then we talked to that
Okay.
parent, and we asked them to reduce the medication, because when the child was coming us, he was so sleepy, he was not able to pay
Yes.
attention to
Okay.
anything, and I requested that parent, if they cannot manage to take off the medication or lower the dose, then I cannot treat him more. So that is the thing, if a
Mm-hmm.
client is not truthful to whether it's of the parent or child, or even the
Mm-hmm.
client himself, if you talk about adult therapy. So if the
Mm-hmm.
child is not giving you the
Okay.
right information, but actually he's
Yes,
feeling,
ma'am.
what is the problem, why is coming to you, what is the thing that is bothering him in life. So for example, if a
Yes,
child
ma'am.
adult came to you and they say that I have issue in you could say, I cannot pay attention to the classroom activity, I'm not able to
Mm-hmm.
study. That is the
Mm-hmm.
conclusion or the problem. It's problem which a child client is facing because of some underlying issue. So when I inquired that
Mm.
client, then I came to know that he was having some form of relationship problem with the family.
Yes, ma'am.
So that is,
Yes, ma'am.
and that problem is manifested always in some other form. So we need to get to that idea, that from where that client is coming and what is the actual issue, and for that a client need to be truthful as well, to share his real experiences with you.
Yes, ma'am. Right. And how do you measure your success with a client, ma'am?
The thing is that the therapy is a very you could say, uh, whenever you start feeling that the client is doing the homework you are giving him.
Mm-hmm.
That is one thing. If that and the client is
Yes,
taking,
ma'am.
the client is taking interest in therapy
Seriously.
by doing all the question
Yes,
and
ma'am.
asking you the question and making some effort, it means that the therapy is working.
Yes.
And when you're doing
Okay.
therapy, you need to be as a therapist, you're putting a lot of efforts. But if the client is not serious about his condition, about taking therapy,
Mm-hmm.
you cannot make any
Mm-hmm.
change in that client. So that is how you're going to understand, you're going to measure your success, that either your therapy is working or not, and the child is actually feeling some change or not. And second thing, when you see the behavior and your parents said that, yeah, yes, the child is able to do certain thing, or the client said that I did something which I did not did maybe for 3 or 4 months. So that's how you're going to
Mm-hmm.
get the idea. that the therapy
Hmm.
successfully.
So do you basically measure your success different clients with different measurements?
It is always different for different client, because it's in a lot of cases that therapy success is measured, depend on the nature of the client and the nature of the problem as
Hmm.
well. For example, if it's some underlying depression, it will take some time. And the thing is that
Okay.
for how long the child or the adult is having that problem. Okay, for a child maybe the
Hmm.
thing is different, but if we talk about adult therapy, then for how long the
Yes,
person is
ma'am.
having that depression, for 2 years, for 3 years, for 10 years.
Hmm.
If a problem is for
Yes,
10 years, then
ma'am.
it could take a lot of time, maybe take a lot of time
Hmm.
for that and person to understand, because we need to dig deep more
So,
into that problem.
ma'am, basically you can't measure the time, or you can.
Like, you can you mean I measure the time of the therapy? Okay, whenever people
Yes,
come
ma'am.
to us and they ask them how much time it could take, so I told you
Yes,
about the
ma'am.
nature of the problem. So according to the problem, you can
Okay.
measure some time. For example, if
Okay.
somebody
Okay.
came for the adjustment issue, then you could work on that easily, maybe. But if the person is having
Hmm.
a depression for 10 years, so
Yes,
you
ma'am.
need to work a lot for that problem as well. So if your child come to you that the child don't have speech, so the moment the child
Okay.
start having some sound means your therapy is working. and and you can never measure these things actually, that how you are going, that
Hmm.
client is going to respond to these things. So these things are always and even these are some new researches on that thing. And according to ethics, you cannot even give somebody some time. It always, because it's a
Okay.
human factor. Every person is,
Yes, ma'am.
so you cannot generalize therapy. You cannot
Okay.
generalize other. You cannot put even other therapeutic intervention on the same child. Or you could say,
Hmm.
not maybe you can apply, but you need to modify always that thing according to that child and according to that client.
Okay. 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 Thanks. Okay. And do you believe that alliance make the therapy successful?
It's very important. Like I told you, if a person, maybe child or adult, is not able to relate to you, not able to share his problem, not able to
Hmm.
because whenever these things come outside, then the things are so painful. And a lot of
Okay.
time
Yes, ma'am.
a client is talking to us, and they share the problem which they might never share some in their whole life with anyone. And they have to dig
Mm.
down so deep inside of them, which is a very painful process. So the moment when
Hmm.
a child or a sorry, child is coming in my mind, because I'm working with both, and I'm too much
Yes, ma'am.
involved
Yes,
in my work. That's why it's coming in my discussion.
yes,
And I
ma'am.
cannot deny
Yes,
the
ma'am.
factor that
I
they're
know.
both important as well. And child is a
Yes,
person
ma'am.
as well. That
Child.
is the point.
Yes,
They're a
ma'am.
person as well. So the moment they start sharing their dark inside, the painful things, the painful memory they have. So
Hmm.
that is the thing that you actually touch and you actually make the client go to these areas, because they are so painful thing. It's not easy to go for the
Hmm.
therapy, and it's not easy to go to the places where you're uncomfortable. So the moment you
Hmm.
get that information from that client, it means that the client is actually ready internally to make some effort to go to these things, or you share some problem with you, or want to work. It's not, if a person is coming to, it means that he want to work on himself. But
Yes,
how it's
ma'am.
going
Yes,
to work
ma'am.
on himself, it depends on the personality type as well, what kind of personality a person has.
Okay.
Because so there's a lot of factor
Okay.
involved in the therapy. You cannot say something that without a lines, it's without the thing is, without a relationship you cannot move 1 minute with that
Hmm.
person, whether it's a child,
Yes,
whether it's a
ma'am. Yes,
therapist.
ma'am.
So the therapeutic
Yes, ma'am.
relationship is very, very important. It should be respectful, it should be trustful,
Hmm.
and it should be, you should set the boundaries as well. For example, if you're going to, boundaries mean what?
The-
You
this was
cannot
my
talk to the,
second question. This
because
was
when
my
you talk to a
this.
client, you cannot talk to that client
Yes,
other
ma'am.
than your therapy setting. Means, yes, you
Right.
can talk to that person. For example, a person asks, okay, can we change the time? And the homework, I'm
Mm-hmm.
having some kind of issue, what could I do about that? Maybe a little bit about that. But other
Yes,
than
ma'am.
that, other than therapeutic and other than objective thing, because it's a very serious thing, you cannot share
Mm-hmm.
even your own experiences and stuff like that, and you cannot, you call your client without any reason.
Any reason, right?
That is
Right.
the point, that if you want to change the time, then you can ask, talk to the client, and you can respond to and, a lot of patients said that we want to talk to you on messages. So if that person is not
Mm-hmm.
talking to your messages, then why he will come to you? The thing is
Right.
that your work is different from a person. The person is living with
Hmm.
home. You're not his friend.
Hmm.
You're a
Yes, ma'am.
you're a therapist. You're a
You are,
professional.
you are, yes, ma'am. Yes, ma'am. Right. And sorry, ma'am. Ma'am, next my question is like, when do you feel like therapy doesn't working on a client?
If if this child um, again child can you
Yeah,
please
you can
it's
tell.
okay
No, no,
no,
you
the
can
thing is
say
that the child,
yes,
the
ma'am. It's
situation is always different,
different.
because they
Okay.
always want to the love you give to those children, that unconditional regard you give to those children, they always multiply toward you. So that's why that
Okay.
relationship is very beautiful. And if you talk about
Imagine.
adults, because the thing is that it's a different form of relationship. Respect is there, they
Oh,
will listen to you. Like if you talk about a child, okay, if us adult client, I'm talking about adult client now, okay, if an
yes,
adult
ma'am.
client is missing the therapy sessions,
Mm-hmm.
if he is
Yes,
not doing
ma'am.
his work, making excuses,
Mm-hmm.
want you to change the time of the
Mm-hmm.
therapy, and uh,
Mm-hmm.
at the time of therapy he start making some excuse, can we do that some after time, I'm going for that thing, I'm
Mm-hmm.
the thing that it means
Mm-hmm.
show that the person is not interested in the therapy as well, he's not interested toward his life in the problem as well. That is one thing. And second thing is that
Mm-hmm.
if he is doing it's it's not always about the fault of therapist as well, he's doing what he can do, that is the point. you know what
Mm.
I do,
Right.
I always look into the different aspect, and over here it's yes. So
Okay.
next question please.
Okay. How do you show you empathy towards your clients?
Sorry, repeat the question.
Empathy. How do you show your empathy to your clients, towards your clients?
Okay, the thing is that there are empathy means that you are putting yourself in the shoe of the client. So maybe physically it's
Yes,
not
ma'am.
possible, but when you give some gesture to the patient, and when you are because there are lot of techniques, actually techniques in the therapy,
Mm.
which shows that
Mm.
you're showing actual empathy to the client. So if that client is
Mm.
telling you something, and that client is sharing something painful, so you
Okay.
listen to that client, and you maybe you don't change the subject, and you listen to the client so very carefully, and ensuring him that that is a place where he can share all his painful memories and the thing which is bothering him, and asking question about that thing, and clarifying things with him. So there are a lot of therapeutic techniques which you could say summarize his problem and ask if other anything other than bother that
Mm-hmm.
client. So that's how you're showing empathy to your client. And the thing is that if
Mm-hmm.
the client understand that there is a listening ear, and there is a place where he
Mm-hmm.
can share all his problems, because you need to make sure that you listen to client everything of the client. Sometimes the client is jumping around in the start of the client. The client will give you a lot of information that
Yes,
which is
ma'am.
important, or you could say every
Yes, ma'am.
which, and you need to even make show them verbally as well that whatever you're saying over here is important, your feelings are valid. So this is more about
Mm-hmm.
how you're communicating to your client, ensure the empathy, that you trust his
Okay.
there's a trust between you people, there's a respect level between, and there's a support as well, and encouragement as well. So these are some
Mm-hmm.
gesture by talking to your client, and you're ensuring that actually empathy is coming from that. And there are a lot of things which are coming from inside. For a therapist, you need to be a
Mm-hmm.
good human being as well. That is
Yes,
the point.
ma'am. Yes, ma'am.
Everybody cannot be a
Yes,
good
ma'am. Right.
therapist. Okay, you will might have
No.
40 student in your class, 40 people who want to be a therapist, and who are idealizing to be a therapist. But it take a lot to know more than to do some to go
You
to that level of.
you need,
And you need a lot
yes,
of
you
patience
need
as
some
well.
patience. So yes, ma'am. You
And
need
second
some
thing is that you
patience.
need to
Have
be,
some patience.
and the thing is that how you will know that you're a good therapist, it's for that you need to be a good human being as well. And for that you need to understand that no matter what happened, the client could say anything to you, in the sense that you need to be patient with that
Mm-hmm.
client as well, and you need to be patient with that therapy process as well, because it will take time. Maybe someday you said that I'm going to do
Mm-hmm.
something with that client, but the client is in some other form of mood. So you cannot change that mood of the
Mm-hmm.
client to come to your point of view. The thing is that second thing,
Yes, ma'am.
maybe the client is upset about something, so you cannot start fight over that thing. I need to be very objective.
Mm-hmm.
I need a lot of training for that, how to be objective, how to put your own needs, and how to put your own things beside the therapy. Whatever you are, you need to keep that things out of the therapeutic room. So that is the point. So you need a
Okay.
lot of patience, and you need to trust on yourself as well, that you are a therapist and you could do this. It's a challenge for you as
Mm-hmm.
well, everyday challenge for you as well. So whenever you have confidence, and when
Okay.
you have a confidence on what you are doing, because a lot of people ask me question, how talk therapy is going to work. Patient come to you, how patient are coming to
Mm-hmm.
you? These are some lame question, and sometimes you feel maybe you want to laugh on that things, but we can understand from where they're coming. Because in society,
Mm-hmm.
maybe in our country, maybe over here we don't have a good exemplary therapist, exemplary psychologist
Yes, ma'am. Yes, ma'am.
who are
Right.
doing beyond what he can do, or we are setting an example, who is an ideal psychologist, and who is working actually to for the betterment of the
Mm-hmm.
people as well. So it's not always about the money. I'm not saying.
Mm-hmm.
I will say one thing, that don't do a free therapy. Maybe if you ask me the tips, I will give at the end as well. Always you charge your patient, because there are ethics, and they have some reasons that you have ethics about a lot of things, whether it's about monetary thing, whether it's about therapy, whether it's about the alliance, or you could say a relationship with your client. So you need to follow these guidelines, and these guidelines came
Hello.
after a lot of researches, and there's reason why we study these things and why we need to
Mm-hmm.
understand these things. So that is a point, and that's how you're going to understand, that's how
Mm-hmm.
you're going to communicate, and that's how, if you don't have a confidence on your own self that you can do some the therapy is going to work, believe me that the client will get that energy, and even children will get that energy as well, that you don't have confidence on
Mm-hmm.
yourself, because when you don't have confidence, it shows. I mean, when you have
Mm-hmm.
some presentation in your classroom, then you get
Mm-hmm.
this idea that person is confident or not confident, either he is prepared or
Mm-hmm.
not prepared. So that is the thing. And
Yes, ma'am.
and don't think that client is coming to you and then he's a fool. Don't overthink that. He's not fool.
Hmm.
Don't overthink that he will not get you are not happy, or you're anxious about something. It's okay, because a human being you could be, but you cannot let that thing come into the process of therapy. So over here your maturity is
Mm-hmm.
very important as well.
Okay. Right. So thank you. And my last question is,
Mm-hmm.
how would you describe your less suitable clients?
Sorry, the voice is cutting. What are you asking? How will you describe you?
Give them therapy, what kind your less suitable clients.
Okay. So,
Like, uh-huh.
okay, can you
Yes,
explain this
speak.
question, that I will give you the answer? Less suitable means what? Less suitable, I mean, in the term of what?
Less suitable means like you don't want to as you said before, if a client doing his homework or doing properly whatever you are saying, if
Mhm.
this kind of client you would like to continue with it, with him or with her. And what kind of clients you don't want to give them season or therapy
Okay.
sessions,
Oh,
you
no,
don't
now
want
got your
to
point. Okay,
give
I will
them
give you the answer of both perspective, because I'm working with child and I'm working with adult as well. So whenever a
yes,
child,
ma'am.
then the child came with the family, with the parent as well. So whenever you feel that the parents
Mm-hmm.
are interfering in your therapy, because I always tell
Okay.
the parents that if I'm working with a child, then I am working for the betterment of that child. I'm not, there's not something I
Mm-hmm.
am want him to do or stuff like that. I will do whatever is good for him.
Mm-hmm.
It's not what is good for me. It's not my ego. It's not even you. A lot
Mm-hmm.
of time parents said they want, they maybe sometimes they came to us and they want a report, in the sense we want our child to do these certain activities. So either the child is able to do that things or not.
Mm-hmm.
That is the point. Maybe a child is MR and
Mm-hmm.
he cannot learn maybe stables, which is difficulty. Maybe the child cannot learn proper communication. Oh, maybe he can learn communication, but he cannot, pass one, two, or three. Like we talk about education as well. So if a child
Mm-hmm.
level, maybe the child is mentally retarded
Mm-hmm.
or intellectually disabled, mild to moderate or severe level of intellectual disability. So over there, our goal, we need to clarify our goals. That this is our goal. We are going to work on his skills first, then maybe then we will work on academics as well. So when my goal is aligned, which is in the best interest of
Mm-hmm.
the child. Okay, when my goal is aligned with the child, with the parent goal, because what goal I will make is according to the child, according to his needs, because every therapy For every child, the goals are different because his needs are different, his abilities are different. He can do different things, and he cannot different do. Maybe he's not good in something, but he have a different
Hmm.
personality as well. So he have different abilities as well. So what I will design for the child will be according to the need of
Hmm.
the child. If parents don't
Yes,
agree
ma'am.
to me on that thing, then I will not. I will
Hmm.
simply politely ask them to, if you're not comfortable with my process, then I'm not going
Hmm.
to work with that child, because it's not
Okay.
it's not something I don't want to do. I want to do, but if you're not comfortable that I'm doing something for the good of the child, and you think that then you can, it's your choice. You cannot I don't want to waste your time and my time as well. So it's better
Yeah,
for us
yes,
to
ma'am.
not to
Yes,
do
ma'am.
this. I know it's I
Okay.
internally I feel that it's not bad for the it's not good for the child, but over here I cannot do anything.
Hmm.
One thing is, the
Okay.
second thing is that if
So.
parent come to me and they say that they have a client, they have a child who's not willing to come for the therapy.
Hmm. Hmm.
Okay, over here you could say, okay, somehow we can engage that child. If adult came to you, a parent came, family came to you,
Yes, ma'am.
that there's a child,
Hmm.
they have a child, in the sense they have adult child, because I'm talking about a parent over here.
Okay.
If that person is
Yes,
not
ma'am.
come willing to come for therapy, so you cannot do a
Hmm.
lot over here. So you're talking about less suitable thing. So maybe that is a place when you cannot force someone to come for the therapy. You can never force
Hmm.
anyone to come to therapy for you to you, no matter whatever you do.
Hmm.
So even you don't need to go to extra mile as well by telling that I'm very good in these things, and I'm just doing these things. I have a lot of degree over here. Willingness is very important, that whether the person come to you or not. That is one thing. And second thing is that if
Or
you
not,
set the boundaries with
right.
the child, with the person, you
Hmm.
know what I mean, which I'm
Hmm.
talking about ethical boundaries.
Yes, ma'am. Yes,
You
ma'am.
ask a client,
Yes, ma'am. Yes, ma'am.
and there are a lot of people who will come to you for secondary gains as well. I'm
Hmm.
but it means to be have secondary gain, because they'll contact you that they have
Yes,
certain type of
ma'am.
problems. Okay, they contact you, they have certain type of problems, then they will try to be your
Hmm.
try to be to indulge in your
You.
life, and they
Hmm.
want to be maybe your friend and stuff like that. They want to have a relationship with you.
Yes, ma'am.
There will be a lot of
Yes,
people you
ma'am.
will encounter. You will encounter a lot of people on that on these things, and they will come to you with a strange disorder which do not exist even in West as well. So somehow they study psychology, and somehow they study some different term. For example, the food fetish
Hmm.
disorder. You will get a lot of message on that thing. I mentioned because you will get a lot of people on that thing,
Hmm.
and you will get a lot of somebody say that I have some form of sexual disorder and stuff like that.
Hmm.
I cannot do that thing. So the thing is that you need to be uh, you know for that thing, if depend on the therapy as well. But you will understand that if you tell your requirement to the person,
Yes.
that yes, we are going to talk in
Hmm.
certain time period, which will be our
Hmm.
uh, consultation, and you have to pay for that. What are the rules? For your rules should be for everyone. Because our
Hmm.
rule for everyone
Yes,
is same,
ma'am. Yes,
that
ma'am.
they pay to you and for what you are doing and the time, and you talk to that person in that time period. You don't have to talk to other person, or
Hmm.
somebody call you and start discussing stuff like that. So you could say to that person that we
Hmm.
have session coming in next week. If you want to book your session, then yes, you can book
Yes,
your session
ma'am.
and book the way other clients are doing same thing. So if you see that that person is not following these things, he have secondary gains.
Hmm.
Maybe you will see a person who will
Hmm.
pay you a lot of money as well. Maybe they will offer you
Hmm.
something else, in the sense of they will offer you gifts. You don't need to take these gifts at all. You know that what is therapy.
Hmm.
And if you think that you are going to contain that client, you're not going to contain that client, because that person is habitual, and that person is doing that thing with other people as well. So you should know what is a
Hmm.
professional psychologist and what is a professional therapy, and how you're going to do that thing. So if you see a person
Hmm.
is coming from what side that is coming, because you will get the idea it anyway. So don't think that you're going to change that client in therapy. It's not going to work. So these are some things which you need to consider before if the person is not following the boundaries, the person is calling you all the time, the person is messaging you all the time. So there are
Hmm.
few clients who do these things. Maybe there's a lot of female maybe who want you to message all the time, but
Hmm.
you don't need to respond to these messages.
Hmm.
Okay, I mean this is the nature of some clients. You cannot
Okay.
you can come, you can have anybody like
Okay.
that.
Okay.
But when these people insist you, when they cross the boundaries of something, they start you calling all the time, and they want your attention all the time, and they're saying we are your client, why you're not paying any attention to us. So when the therapeutic
Hmm.
relationship boundaries are crossing, then it means that
Yes, ma'am.
that is not a person who want, maybe he want therapy. No, it's not because he's a patient, that's why he's doing these things. But if
Hmm.
these things cross, then you cannot work with that client, and it's better for you to, and it's better for
Mm-hmm.
your own emotional health as well, because you're a human being as well. You cannot bother all the time.
Hmm.
It's your personal space, your personal
Hmm.
time. If that person want to come, then there's a way to that time, there's a way to that discussion, so he should follow
Hmm.
that thing. So I'm sure I make myself clear to you that
Okay.
how these things work, and how you need to take care of these things, and
Yes,
how you need to
ma'am.
take care of
Yes,
yourself
ma'am.
as well, because you're a human being as well. You have your own needs. If you're not feeling okay, then I suggest that you do, you change the time of the therapy. I mean, you change the, you do you if you're not feeling good in yourself, then you cannot do the therapy. So maybe sometime for your own
Yes,
personal
yes,
sake,
ma'am.
you take a little bit break from that thing as well.
Yes, ma'am.
So I'm sure the information I provide you is
Hmm.
the value to you and the value to other people who would listen
Yes.
to that thing.
You have gave. Yes, ma'am. Chala, yes, ma'am. Thank you so much. Please, sorry, I'm fumbling. Don't know why, but but thank you so much this for this
Actually, the thing is that it's not just
Chala,
fumbling, it's,
ma'am.
maybe it's some issue with the internet connection. So whatever you said, that it's total fumbling
Okay.
everywhere. So I want you to repeat what you were saying at the end.
I was saying thank you so much for giving your precious time and sparing your time for me, especially. And it is literally means a lot for me and inshallah for my classmates too. And hope your information
Okay, thank you so much, Abiba, for having me. And I would love to share my experiences, those who are doing this or who want to come into that, who want to be a therapist. And I would definitely give you my, I think you have my page link as well. And you might have seen that I'm doing a lot of awareness for the parents, for the therapist, and for the children as well, and for mother as well. So it's somehow I'm doing advocacy for the mental health. And I want other people to understand that mental health is very important. You need to talk about things, and you need to talk about things more and more. So thank you so much for having me, and I would love to come whenever you ask me to come on these discussions, because what I believe is, if we want to change, then we want to talk about these things frequently. So that's how we are going to bring change. Okay, thank you so much, Aviva.